everyone. We will see how you should support your loved ones in their cancer journey. I would say whenever you're diagnosed with a cancer, this is definitely a second life in your entire life journey. And what is most important, I've seen the hand-holdingness done by their family members. Because it's not the patient who is there in the journey, but the family members' integrity, their loyalty, standing hand to hand, shoulder to shoulder with the patient is the most important thing. Because during this treatment journey, there are a lot of ups and downs in the patient's mind, which you have to definitely combat by having a good, beautiful relatives, those who are supporting them in their entire treatment. Sometimes patient might be fed up with their eating lifestyle because they're not being able to eat what they were eating prior, which is very important. Everybody has a right to eat, which we are depriving them of because their jaw has been removed, their tongue has been removed, they're not having the natural food and the taste that they should have. But yes, solidarity is shown by the family members. It's the most important thing. We have seen members those who are more than 100-year-old, but still the family members are standing shoulder to shoulder with them so that this particular individual should be free of cancer and do routine follow-up. Not only performing the surgery is important, completing the entire treatment duration is the most important thing. And once you complete the treatment, the most important is regular follow-up with your doctor. For initial 2 years, every 3 months, subsequent 3 years, every 6 months. Once you have completed 5 years, once in a year. If you do this, chances of relapse can be picked up early and overall diagnosis and treatment can be done in a much better way. If you've got any patient pertaining to head and neck cancer, do come down to me and we are always there to help them out. Thank you very much.